Good morning. My name is Twanisha Johnson. I am the Chief Operating Officer at AFSPA, the American Foreign Service Protective Association. It is my pleasure to welcome you to our 2024 annual member meeting. It's my role today to serve as host and to introduce you to our wonderful speaker lineup throughout today's program. I want to extend a warm welcome to those who are attending in person, as well as the hundreds of members who are attending online from all over the world. Additionally, I'd like to acknowledge our board members who are here today. Many of them are attending remotely, as well as a few of those who have joined us on site today. Our board chairman, Mr. Tracy, thanks for being here. Directors, Mr. Chuck McCarter, Mr. Dave Witten, we really appreciate you being here on site and for your ongoing support of the association. It is my honor to introduce AFSPA's board chairman, the Honorable Thomas Tracy, who will offer a few opening remarks to the group as we get started.
Good morning, and thank you very much. I always like seeing the members turn out for the board meeting and for this particular meeting. So I'm going to talk today about some of the problems of accessing primary health care, which has gotten more difficult as the years go by. The short answer to why the primary health care is getting more different is there are not enough primary doctors. But why is that true? Well, there are a number of reasons. One reason is that hospital chains and also other kinds of big health groups are buying up individual solo practices and group practices and integrating them into their system. A second reason, and this is in my personal opinion, is that Medicare does not sufficiently compensate primary doctors. And that causes some doctors to move to specializations where the compensation is better. This is particularly true for people of our age. This is a real issue. As a result, some doctors in primary care are now moving to concierge. That's also a growing phenomenon. And for those people who take the concierge approach, you're going to get good service. It's going to be for the 10 or 20% of the doctors, patients who move to that. You're going to get good service, but it's going to throw the other 80% or 90%, whatever the number is, into the general market, which is already crowded. So that's another problem that we're facing. Many clinics have become a substitute in some ways for primary care, and they work very well for one-off simple issues, but they do not provide continuity of care, and they vary greatly between different clinics as to how good and what services they can provide. So all of this brings us to the point of where are we today and what do we do? I would suggest to you that, like it or not, we're all going to have to manage our health care much more closely than we may have done in the past. And the emphasis of the association is to provide you with every tool we can. And we have a rich collection of programs and benefits that will help you manage your care. Today, we're going to be talking about Teladoc. Probably none of this is as good as it was when you had your own primary care doctor, but nonetheless, we have to deal with the world we live in, and I do not think that primary care situation is going to get better anytime soon because the forces that are dealing with it are so large and great. So it's up to us, the association, to provide you with every tool we can to help you get through these issues. So with that, I'd like to thank you for coming. We really appreciate it. We like to hear from you, quite frankly, because we're a member organization and we're trying to provide as good service as we possibly can in what is a very tumultuous time in medicine. Thank you.
Thank you so much, Mr. Tracy. I think your discussion and your remarks about continuity of care certainly tie back in very well to some of the topics that we'll hear about from speakers later on this morning. I've had the pleasure of working very closely with this individual, this next speaker, for the last 6 years of my career. Mr. Kyle Longton is the Chief Executive Officer and Executive Vice President of the American Foreign Service Protective Association. In this role, he provides strategic direction and executive leadership to all of AFSPA's program that includes the Foreign Service Benefit Plan, which you all are very familiar with. In addition to his AFSPA duties, Kyle serves as the Executive Director of the Senior Living Foundation, which is AFSPA's 501c3 organization, in which we offer grants and supportive services to retired Foreign Service community and their families. Kyle holds a Bachelor's of Arts in International Studies from Center College of Kentucky. He has a Master's in International Affairs from George Washington University. He is a Certified Association Executive, CAE. He is a Certified Medicare Subject Matter Expert, and he is a Registered Employee Benefits Consultant. And while Kyle has quite a few credentials and letters behind his name, more importantly, he's just an awesome human being and such a joy to work with. So it is my pleasure to introduce you all to my friend, my colleague, and the CEO of AFSPA, Mr. Kyle Longton.
I actually do pay her to say those things. I will add my welcome to Twanisha's and to Mr. Tracy's, and just say thank you all so much for being here today. Whether you're joining us virtually or here in person, we've got a pretty full house here for those who are joining virtually and can't see it. Thank you all. I know some actually took the day off work. Some rescheduled other appointments to be here, so thank you very much. We aim to make this worth your while. So I want to jump in with a review of what we've done in 2023. I'm going to make sure my clicker's working. So just a quick review of where we were toward the end of last year with open season. We are still seeing a lot of open season events over the last few years in the virtual space, and we've done our best to modify our offerings in that way. But we also have had a lot of agencies and return to in-person events. Our staff and our partners attended 29 domestic in-person events. Most of these were in the Washington, D.C. area, and our staff who are producing this event, manning the cameras and so forth, were the ones who were present at those events. We also had partners attend events in Mississippi and in Ohio, and those were some of our partners from Aetna who went to those events. We also did 10 webinars. Did anyone attend one of the open season webinars? Good, good. Some of them were at 5 a.m., some of them were at noon or 1 p.m., and some were at 10 p.m. So we do our best to reach members wherever they are. We also had recordings of those available afterward, and tried to also supplement that with some podcasts and other events. Additionally, we had teams visit 8 countries, Europe and Asia this year, offering close to 24 briefings. Aetna did support us on one of those trips, and we also took that opportunity, as we do every year when we travel, to visit with some of our partner facilities around the world, check in with those relationships that provide direct billing opportunities for our members around the world. This was a busy open season, and it was our most successful to date. We have processed more than 4,500 transactions. So those are changes from self and plus one to self and family. Those are people enrolling in the plan. Those are people switching from FSBP to another plan. This resulted in 3,004 new enrollees to the Foreign Service Benefit Plan. Total enrollment now stands at more than 105,000 members. You can see more than 61,000 are dependents, and almost 44,000 are the enrollees. So those are the active duty employees and the annuitants and retirees. So we take this growth, but also this continued responsibility very seriously. We recognize that that those of you who are here attending, and then your colleagues, more than 100,000 of them around the world, depend on us for health insurance and for support in various ways. So we take that seriously. We will continue to do all that we can to meet your expectations and fulfill the promises that we've made to you. Which brings me to my next point, and the next couple of slides. This is when we look at claims volume for the last year, we had more than 1.7 million claims just for 2023. We estimate, because we haven't received all the 2023 claims yet, people have until December 31st of this year to file 2023 claims, but we estimate that at more than $467 million in claims paid. I do expect that number to go up some as we continue to see some claims come in, but this is our best estimate at this point. You see the statistics there, 99.57% claims processing accuracy, more than 93% were processed within 15 calendar days. And when you look at the overseas claims, more than 95% were processed within 21 calendar days. So this is well within OPM's expectations as well as within our own expectations. And so we continue to strive, particularly keeping a focus on those overseas claims, because we recognize many of those members are paying out of pocket and waiting on reimbursement for us. So we do try, we actually have a dedicated team with our partners at Aetna who focus only on those overseas claims, making them a priority for processing. Now, contacting us, we had more than 64,000 calls come in for the Foreign Service Benefit Plan alone last year. Throughout the year, the average answer speed for those calls was 7 seconds. We also received a record number of emails. We responded to those in an average of 3 business days. If you've tried to contact us in the last 4 months, essentially since the end of October until really this last week, I'm sorry. We have not met your expectations during that time. People have been on hold for extraordinary amounts of time. People who requested callbacks sometimes did not receive them or did not receive them for days on end. I'm very proud to announce, I'm proud of the team because we've been working overtime. We've had groups of staff dedicated just to the callbacks and to improving our customer service standards back to where they should be and back to what you expect they should be. The callback queue has been cleared, where about a month ago, we had more than 200 a day coming in. We've cleared those. We've seen the overall call volume come down, and we are responding to those callbacks and meeting our expectations for the average answer speed in less than 30 seconds, as you come to expect and as it should be. I'll be happy to answer questions later. I'm just going to continue for now, but I do want to apologize for anyone who has tried to contact us. We have been a little overwhelmed in recent months with these new members, but also with questions about our prescription drug plan. More information on that coming up soon. But I thank you for your patience, and I thank you for your continued trust in us, because we do remain passionate about serving our members. When it comes to prescriptions, these claims we have accounted for separately. Almost 700,000 retail claims for prescription drugs, over 500,000 mail claims for prescription drugs, so for a total of 1.25 million prescriptions filled. The Foreign Service Benefit Plan paid more than $106 million for prescription claims alone last year. And our percentage of what we pay for prescription drugs is 91.1% of the prescription costs. And in past years, and this holds true this year, the Foreign Service Benefit Plan is paying the highest percentage of prescription drug costs of any plan in the Federal Employee Health Benefits Program. So we have maintained our co-insurance and co-pay rates, even as drug prices have increased, even as utilization has increased across the board. And as new drugs, none of which are inexpensive, have entered the market. So we're proud to continue to provide access to these drugs and support for our members through these benefits. And that comes to our philosophy about trying to fit all the pieces. Mr. Tracy talked about the complexity of the healthcare system, and with primary care at the center of that. Also at the center of personal decisions is really about how each of us uses healthcare. We've attempted to structure our benefits in that way to meet the needs of our members around the world, whether you're receiving care just down the street from our office or in Japan, in Germany, where we have huge memberships. We've tried to take this into account by keeping our benefits clear and as simple as possible, but really fitting the pieces together to provide you all with the best possible coverage. And we'll hear a little bit more from our speaker on Teladoc later, as well as our video from our partners at Maven about ways in which they're bringing healthcare closer to you. But we've been doing this for more than a decade, providing opportunities for members to bring healthcare into their home with smart healthcare devices. I have in my office, I'll bring it after the break if anybody wants to see it. I have my own Livongo meter for diabetes management. We also have similar programs for hypertension as well as weight management, all through Livongo. We also have that comes into the connected devices. How many of you have tried Hinge Health? Hinge Health? This is the home virtual and physical therapy program that we actually spotlighted in this program last year. It is by far our most popular program since we launched it. It is available to members. We opened up availability following feedback we received from last year's annual meeting. We weren't at that time offering it to members who had Medicare Part B as their primary payer. It's now open to all members age 18 and older in the US. It's not yet available overseas, but this is one of our most popular programs, and it can help people address chronic pain as well as acute issues they may be having with joints, anything from their fingers to shoulders, lower back, knees, and hips. And it has helped people avoid surgery as well as improve mental health, self-reported aspects of mental health by engaging in this program. So I encourage you, if that's something that is of interest to you, please, I would be happy to share more with you. Perhaps some of our users would also be happy to share more later as well. We also have in-home programs for infusions for folks who are on medications that require infusion. We have programs through our partners at Express Scripts where they actually have nurses who can come to your home the first few times, help you prepare the infusion and administer it to yourself if that is a level of drug therapy that you're on, so that you're not having to go to an infusion center or a doctor's office several times a week just to receive your medication. We've offered this for many years, and it does help make accessing your medication, receiving the therapy that's been recommended for you, much easier. And when it comes to telehealth and telemedicine, we have a number of programs. I don't want to steal the thunder from our colleague from Teladoc later, but I do want to mention that we do have programs that offer care both in the United States and overseas and in a variety of ways. We also have coverage under our telemedicine benefits for you to have a virtual visit with your own provider. So the telehealth is where we're talking about a visit through Teladoc with their overseas arm through our V-Health services. Telemedicine, I had an appointment last week with my with a specialist I see, checking up on lab results. We hadn't seen each other in 6 months, but she'd ordered labs for me. We were online for about 15 minutes, discussed the labs, changes in my prescription medications, verified the pharmacy, and that was it. That was a telemedicine visit. We cover telemedicine visits the same as we would an in-person visit. It just allows you the convenience when it's something simple like following like a quarterly checkup or a follow-up on prescription medication. You can do that from the comfort of your home. So please keep that in mind as you're looking at your doctors, you're discussing those follow-up visits. You may not need to go into the office every single time. The whole idea here is to provide our members with the right form of intervention coupled with the right support programs that meet the patient where they are, that provide you the type of support that meets your specific needs. And that can come in a number of different forms as well, including our dedicated care management program that we've had and continue to add to. We have a dedicated team of nurse care managers through our partners at Aetna who are there to provide you with a variety of support programs, including one-on-one continuous support if you are facing a new diagnosis or a chronic condition diagnosis. They can also answer questions for you about doctor's orders if those are changing from one appointment to another. They have on their team also social workers and pain management specialists as well as dietitians, all of whom can bring their expertise together to support your needs. There are also programs for compassionate care. There are times where we ourselves or those in our family may be facing an end-of-life situation, a terminal diagnosis. And there is a program there to support you, whether it's your own diagnosis or you're helping care for a loved one. They have a comprehensive program to support you when that is a phase of life that you and loved ones may be in. We also have a cancer support program that is comprehensive and brings in information about not only the medical treatment, but also prescription drug treatments. There are additional programs that come with that, including our therapies cuisine. Cancer patients often struggle with what to eat, when to eat, lack of appetite, and so forth. There's a specific program that we offer actually in concert with Express Scripts and the Accredo Pharmacy that offers you advice on the best way to approach those challenges when receiving treatment for cancer. I've already mentioned the Livongo program, which our care managers can help refer you to for the chronic condition management. And they also make referrals to the Hinge Health program, which is our virtual virtual exercise and physical therapy program. I'm going to get all those words in there to get it right. But that's a fantastic program, which not only provides you with what they call a playlist of different exercises to do to address your particular needs, but you can have virtual visits with a health coach as well as with a physical therapist through their dedicated app. And they've improved the program recently so that they're not necessarily sending out, if anyone's engaged in the past or learned about it in the past, they used to send out bands that you would put on your body to help measure your range of movement. They've improved the software behind the program so much that those bands are no longer required. You can actually identify it using your own personal mobile device as you're doing the exercises. So I encourage you, again, take a look at that. And then many of us may find ourselves in a situation in our lives where we receive a serious diagnosis. It may be a neurological condition. It may be a cancer diagnosis. It may be recommendation for major surgery. And we may trust our doctor, but this may not be their particular specialty. And so we might be looking for a second opinion. FSVP is proud to offer some programs to support our members both in the US and overseas with obtaining those second opinions at no cost to you. These programs are offered free to our members. In the US, we've changed to a new program this year called Second MD, and this addresses serious diagnoses. You work with a care manager, they can refer you into the program, and then you will actually have a virtual visit with an expert in your diagnosis. They will review the lab information, the imaging, any pathology slides and so forth, and be able to provide you with an expert second opinion. The same program, a similar program is available for our members overseas through the clinic, what we used to call the eCleveland Clinic. And here you submit your information. It's reviewed by an expert of the Cleveland Clinic, and they provide you with a written second opinion within about 5 business days of receiving all of the information they need. And so this can provide you with new things to think about, a secondary path of treatment to discuss with your doctor, perhaps a referral to another specialist for your condition, but it is there to support you so you can feel good about your path forward when you're facing these serious diagnoses. So again, anyone who may be facing that, I encourage you to take advantage of these programs. For those of us who are just trying to get through the day-to-day, and maybe managing our general health, maybe managing a chronic condition or 2, as is the case for more and more Americans, we do offer the Lifestyle and Condition Coaching Program, and I'm delighted that thousands of members took part in this program last year. It is truly a holistic approach that we offer to help members achieve your best health, not somebody else's, but what works best for you. This is an individualized program. It offers you more than 40 different areas of focus, including just general health, weight management, both for adults and for children, stress management, which I think all of us could use a little help with from time to time, pain management, cardiovascular disease, high blood pressure, and even pulmonary issues such as COPD and asthma, again, for both adults and children. This is available worldwide, and this takes a number of different forms because one size doesn't fit everybody, even when it comes to health coaching. So in some cases, if you prefer a one-on-one telephone conversation, they'll offer that. If you prefer it online, they have that. You want something in a group setting, they've got that as well. So there are a number of different ways to engage in this program and to receive the support that you want and that you need to achieve your health goals. Some of you may have already seen our theme for this year has changed. You can see it right there in the center. We're starting to add more and more around it, but it's right there in the center is choose health because you matter. And we really do mean that. That is our focus this year. Tom talked a lot about earlier about our desire, our goal to provide you with the tools and the support that you need. And we're looking to you, the members, to take that step, to choose to use those tools to take advantage of the programs that we offer. And the programs come in a variety of forms. We're going to continue to remind you, including in today's email message that I sent to all of our members, about the importance of receiving preventive care and screenings, about taking part in activity for 30 minutes every day, and so forth. We're going to remind you about our Simple Steps to Living Well Together program. I'll touch on that in the next slide. We've already talked about the lifestyle and condition coaching program. For those who may be in a time of life where they're considering pregnancy, we do have a comprehensive healthy pregnancy program. We also offer virtual care in a number of ways. And we'll also continue to let you know, remind you about the importance of quality nutrition, sleep, and exercise. We'll hear a little bit later from Maven. And we have our member engagement platform where you can, through the Aetna Secure member website, engage with a number of these programs, including digital coaching and some of our other wellness programs. And many of these wellness programs do contribute to our Simple Steps to Living Well Together program. I want to remind you that if you are a member of the Foreign Service Benefit Plan, whether you're the enrollee or dependent, and you are at least 18 years of age, you can earn up to $400 every year in wellness incentives. How? Get your annual physical. Complete the biometric screening as part of that. Complete the health risk assessment. If you've not done the health risk assessment before, this takes about 20 minutes, either over the phone or online. And it's going to ask you questions about some of your vital statistics. What's your blood pressure? What's your cholesterol? If you've got that information, great. If not, you can keep moving through it. But it'll also ask you things about how many hours per night do you sleep? How's your nutrition? How much do you exercise? It's going to take all that information and help you identify your health risks and your health goals. And then we are able to use that information to connect you with programs that we offer that can help mitigate those risks and meet those goals. Programs like our condition-specific health actions, including presenting evidence that you're managing high blood pressure or diabetes or a number of other programs. We've got digital coach programs. Even just having your recommended cancer screenings for colorectal cancer, breast cancer, cervical cancer, all of those can add up. $25 here, $50 there. Even getting your flu shot, or, and it's not on here, your COVID booster shot, one per year, despite changing recommendations from the CDC, but one booster per year is eligible for a $25 incentive. So please, I did the calculations last year, and in 2022, I think about $25 million was left unclaimed by members who did not complete the wellness programs. Get started today. You can take part in that in the health risk assessment today, and go ahead and schedule your annual physical today, just to know where you stand and start talking with a coach or with your doctor about where you want to go. So every year we've offered some helpful tidbits, and one of these hasn't changed. That's why it's on the bottom part of the slide. But I do want to note, because this has come up in some of the questions we received in advance of today's event, about prior authorization, or PA, for prescription drugs. Has anybody encountered this before? I got some, for those of you at home who may not be able to hear, there's a little bit of laughter in the room. So more and more prescription drugs are requiring prior authorization. And this is basically a communication between the prescriber, your doctor, and either the health plan or the pharmacy benefit manager to confirm that the drug is prescribed for the right reason. I will use some of the GLP-1s that are out there right now. So we've heard about, perhaps you've heard about Wegovy and Ozempic. And so Ozempic is they're made by the same company. They are the same drug. They are marketed differently. Ozempic is approved for diabetes treatment. It does have the effect of incredible weight loss. Wegovy is approved as a weight loss drug. So we have seen instances of people being prescribed Ozempic for weight loss only. They have no diagnosis of diabetes diagnosis. So in that case, the Ozempic The prior authorization comes in to make sure that the right drug is being prescribed for the right reason. In that case, the Ozempic would be denied for weight loss only, unless, again, the person has a diagnosis of diabetes. That's just one example. It's a frequent one that has come up in recent years, I should say recent months, particularly with some drug shortages. But this is coming up more and more as more drugs are being introduced that have different indications and can be used to treat different symptoms. But in some cases, they're being prescribed for things that are off-label, according to the FDA. They may not have been fully approved yet for something that a doctor is issuing the prescription. So the prior auth comes in place there. Can also come in place to make sure it's the right dosage if something has changed from a prior prescription. It is meant as a safety measure, as much as a double check to make sure that it's the right drug at the right time for the right patient. The other tidbit I want to remind everybody of, because this came up in the questions and comes up probably weekly for our health benefits officers, and that's a HIPAA authorization form. I've been dealing with this recently with my own family, where I've had a family member who's been in and out of the hospital over the last 4 months. I can't call her health insurance. I can't get the information. I can get basic information on her coverage details, and that's it, because they don't have a HIPAA authorization form naming me as an authorized representative for her. And so we've been going through that and trying to file the form, but we're doing this while she's been in the hospital, not always able to sign her name to form. So I encourage you, if you ever think that you would want someone else to be able to call your insurance, get information about claims, about benefits on your behalf, please take a look at the HIPAA authorization form. It's on our website. We'll be happy to direct you to it during one of the breaks or the Q&A later. We we are prevented by HIPAA in terms of how much we can share, even if the person's covered on your plan, even if it's your spouse, there is a limit to the amount of information we can share with somebody. So please make sure you've got that in place. If you have a power of attorney document that specifically mentions healthcare, you can submit that to us. That doesn't have to be renewed. The HIPAA form usually only lasts about a year before it needs to be renewed. I encourage you, please, just from my own experience, make sure that's in place if you think you would ever need that. We've spent a lot of time talking about the Foreign Service Benefit Plan and healthcare in general. That's not all we do. In fact, when AFSPA was founded 95 years ago today, we were founded to provide a life insurance plan for members. Well, we still offer life insurance. In fact, we have 3 life insurance plans, and actually saw huge growth in our life insurance last year, and large growth in our dental enrollment. We offer 4 dental plans, 3 that are stateside, and 1 that is a true international dental plan. We now offer 1 disability plan. That's a change from last year, but we have continued to review what's on the market, feel that this disability plan that we offer in partnership with Cigna is the best that is available to our members worldwide. We also have a critical illness plan. We'll be doing a bit more information about this to members come the second quarter of this year, but this does provide specific coverage should someone be diagnosed with a heart attack, a stroke, invasive cancer, non-invasive cancer, and a limited number of other diagnoses. For our members who may be outside the U.S. and may be covered by Foreign Service Benefit Plan, but they perhaps have members of their household, a domestic partner, parents, children over the age of 26 who are not covered by their FEHB insurance, they may need members of household insurance. This is commercial health insurance that we partner and offer to members who may need that for their members of household. We also have a number of partners in the legal space that are local law firms with some specialty in the needs of foreign service professionals. We have a retirement planning partnership with Retire Fed and Tammy Flanagan. We have travel insurance that we offer through a partnership. We also offer financial planning and tax consultant services, including a brand new partnership with GIBA, not GIHA, GIBA, and their wealth management services. So that was just announced in this morning's CEO message. So if you haven't learned about that, our AIP team is out there. We'd be happy to tell you more about that, or you can learn more in today's email. But we're very happy to have that and to bring a new offering to our members. Finally, we also have a couple discount care programs. We have one that combines dental and vision, including LASIK services. There is a monthly cost to this. I won't call it a premium because this is not insurance. I've checked that box for compliance reasons. It's not insurance, but it does provide some assurance of what you're going to pay when you walk in the door, because this does work with a network of dentists, as well as the VSP network of vision professionals across the country. And you know what you're going to pay when you walk in the door. You can see it's 20 to 60% savings, 40 to 50% when it comes to LASIK. So this is something that costs a lot less than dental or vision insurance, where you've got both, and it doesn't have limitations. So if you're someone who wants to get your teeth cleaned 4 times a year, you can go get your teeth cleaned 4 times a year, have that discount every time. Typically, insurance may limit it to just twice a year. So keep this in mind. It's a great alternative to insurance. You do have to go to one of their network providers, and it only works in the US. Also, I've made a plug for this in past years. I will continue to do so. The hearing aid program that we have with True Hearing. This is a fantastic program. I've used it twice myself to purchase new devices. And the pair I have now were originally at retail $7,700. I paid less than $4,500. I didn't have a hearing aid benefit. If you're a member of the Foreign Service Benefit Plan, you do. It's $4,000 every 3 years for new or replacement devices. You go through True Hearing, you get that discount, and you can greatly reduce your out-of-pocket costs for hearing aids. I encourage you to keep this in mind. It also comes with oftentimes replacement of the aids if they stop working during that 3-year period and so forth. So give them a call today. Check that out on our website. You can see the link there. And just looking ahead a little bit, we're watching the challenges as well as the opportunities that lie ahead. We continue to see a lot of changes in coverage opportunities and how products are bundled together, both by doctors, how they're bundling things, and also how our partners are offering new products and sometimes overlapping. Tom mentioned the consolidation of the healthcare environment, where we do have hospitals buying up imaging centers and individual practices and group practices and so forth. There are a number of changes that may be on the horizon that we've actually seen in recent years that have come from OPM. Such as changes in fertility coverage. And I'll talk more about that in just a moment. One of the big challenges, I don't know about you all, but that I have personally is trying to coordinate care and records. I recently had labs done for one doctor. I had to go to the LabCorp site, download them, and upload them into 3 different portals for 3 different doctors so they had the latest information. I don't know if anybody else runs into this, but it can be a challenge keeping track of all of that, making sure doctors have the information they need when they need it. We do try to continue to bring healthcare closer to you in a variety of ways and with our partners, and providing options for everyone who may be interested in that level of care. And also just reaching members at the right time and with the right support program. So, and overall, we're looking at ways to increase our benefits and increase our support to members. And so in 2024, we did a few things. I'm just hitting the headlines here. There were some smaller changes, but I wanted to hit the headlines here. Anyone who likes the massage therapy or the chiropractic or the acupuncture, hopefully you appreciate the change in the benefits. We went from $60 per visit to $75 per visit. Still 50 visits for each type of alternative therapy every calendar year for every person covered under the plan. So I've had a question before, I've got a family plan, am I sharing this with others? No. Each person in the family gets 50, 50, 50 for each type. We also, as I mentioned before, increased our infertility coverage. So there were some changes in 2023. We introduced a limited coverage for infertility. That changed a lot in 2024 per OPM mandates, and also we went further than the OPM mandates. So we removed all dollar limits on artificial insemination and in vitro fertilization. We are one of the few plans that is covering both the medical and the prescription drug side of in vitro fertilization services. All plans were required to cover the prescription side there. Not everyone had to cover the medical side. We chose to do so. I will note that for those who may be interested in these services, prior approval is required, whether you're receiving the services in the US or overseas. This is one of those few covered one of those few benefits we have that does require prior approval when overseas. We also added Maven Clinic for additional support for members around the world, both infertility, but also with maternity, early parenthood, and all the way even through menopause. And we'll hear a little bit more from Maven a bit later about all of their programs. Also, we improved our gender-affirming surgical benefits to be in line with WPATH standards that were released in 2022. Once again, this does require prior approval both in the US and overseas. All right. I think I can skip the Medicare prescription drug. Nobody's interested, right? All right. Nobody's going to throw food either, right? I spoke to a group in Florida, and I got up to talk about Medicare prescription drug plan just as they served the salads. Happy to report I survived. I'm here today. I want to talk about this because it may be of interest to many of you here and to many of you at home or even watching the recording afterward. I want to walk a little bit through sort of the process and where we are today with the, I'm going to use the full term one time, hopefully, and then switch the abbreviation for the Foreign Service Benefit Plan Express Scripts Medicare Prescription Drug Plan. You all okay if I say PDP from here on out? Okay, good. So for the PDP, so I just want to take a moment and mention that Medicare prescription, Medicare Part D as in drug plans have been around since 2006. FEHB plans for many years have wanted to offer an option to members to enroll in a Part D plan under their federal plan. OPM was not open to this. Some recent changes, including the Inflation Reduction Act that passed and that will allow Medicare to negotiate with drug companies to lower prices on specific drugs, led to a change in OPM's thinking. And so for the first time in 2024, they opened the door for plans to offer prescription drug plans, or what they call EGWP plans, employer group waiver plans. I'm going to stick with PDP. So for someone to be eligible for this, they must be enrolled in either Medicare A and or B. And members must be receiving their insurance through retirement benefits. So if somebody has Medicare A, but they're still actively employed, they would not be eligible for this. In the preparation for 2024 open season, 10 plans within the federal program chose to go through this, and they chose to do auto enrollment. Now, how they did auto enrollment varied from plan to plan, but they did engage in this. There meant a total of 16 plan options. And everybody, once I've got the full list, when we take a break. Now, when OPM looked at this, they projected that that in addition of PDP to these programs would reduce total FEHB costs by approximately 2.8%. That's with not every plan taking part in it. Now, OPM did mandate the language for the announcement, and the language did downplay the income-related monthly adjustment amount, or the IRMA, and it did end up delaying the announcement until late October. So we did decide to take advantage of this opportunity for 2024. We saw it as an opportunity to provide savings for everybody enrolled in the plan, but particularly for those who were eligible for the PDP. We did enroll members age 65 and older who were eligible, Medicare A or B, and retired, in a Part D plan. We did this as an auto enrollment with an opt-out option. We also understood that about 47% of our members who are eligible for Part B don't take it for a variety of reasons. And for many people, that reason is the Part B IRMA. The premiums go up quickly under Part B as you move into higher income levels. There is also an IRMA with Part D. It doesn't go up as quickly, it's not as costly, but it is a factor for many people. So we also tried to structure our cost sharing to make the option appealing for our members. This includes co-pays as low as $2 for a 30-day supply of generics or $4 for a 90-day supply. Includes an expanded network of pharmacies, allowing members to obtain their 90-day fills, not just through home delivery, not just at CVS or Walgreens, but at any network pharmacy. And you can also get your specialty drugs, not just from Accredo, but from any network pharmacy or through home delivery. We collapsed the 3 specialty tiers into a single tier, and we also capped the prescription out-of-pocket maximum at $2,000 for the calendar year. We did our best to get the word out there. We did direct email and mail. We had webinars. We did a live Q&A at the end of November. We also included this in all of our open season webinars. I feel like we did get the message out there in a good way to most members. We had almost 13,000 members who were determined to be eligible. That's both enrollees and dependents. Close to 2,000 opted out, so about 15%. That was actually fewer than we expected. And I think people, in some cases, saw the value of it. We do anticipate that some will continue to disenroll throughout the year. We've seen about an additional 5% drop off in the last 2 months out of this program. And when you don't have the Medicare Part D program, the PDP, you just return to the benefits that you have under the Foreign Service Benefit Plan that you know. So, where did the trouble come in? I'll say this, I don't like to pass the buck. I've already done a little bit to OPM, I'm going to do a little bit more. The notification to members came out a lot later than we would have liked. We had a rollout plan that we had planned to launch earlier in the fall to get information in front of members, start giving you the option and understanding what this program would be, and we were not able to do so. We had some initial implementation challenges in January. Those have largely been resolved. We also continued, as I said, to see members deciding to disenroll. Some didn't realize that there would be an IRMA if they qualify for that. Some said they didn't realize this was happening at all. We are continuing our ongoing work to improve services for our members, whether that's in prescription drugs under the high option Foreign Service Benefit Plan or under the Medicare Advantage Plan. We are working on that with our partners at Express Scripts. We've also learned a lot of lessons from this in terms of what our members expect from us and how they expect us to communicate with them and what they expect from their benefits. And we are incorporating those, and we've shared them and have another meeting coming up to share those with OPM and work that as we consider our options going forward and what future programs may look like and what the future of this particular program may look like for people who age into it. So I will say, I am sorry to those who were taken by surprise by this program, who were inconvenienced, to say the least, in some cases, by this change to the PDP. I appreciate all the feedback that I've received, and it's ongoing. I anticipate more questions about it in our Q&A later today. But I do appreciate that. It helps make us better. And I encourage you that as you have concerns, please continue to contact us. Please let us know. If we can't answer the question, we will get you an answer from Express Scripts or from someone else. But we are here to support you and want to do our best by you as our members. Just before I wrap up, I do want to mention, Twanisha mentioned earlier our Senior Living Foundation. We are very proud of the work the Senior Living Foundation does to support foreign service colleagues encountering challenges that come with aging. We have our Resource Center, which provides guidance. We do provide grants for care management, prescription and medical needs, durable medical equipment, basic living expenses, home care, and more. We also have a parent program we launched just over 5 years ago that helps provide limited guidance. This is much more limited than our program for retirees, both in its scope, its time, and any financial support, but does help active duty foreign service officers and personnel whose parents may be facing challenges, particularly in an emergency or time of transition. We're there to provide some help. We will have our biennial Planning for Change session in September. This is a half-day session, which will be virtual this year with an option to attend in person, most likely in this same room. And we look forward to hopefully seeing some of you all there. And we haven't fully wrapped up 2023 yet. We are still getting some invoices and such, but we did receive a total of just shy, $14 shy of $600,000 in donations in 2023, and our grant expenses exceeded $690 in 2023. We did have some late bequests that came in later in the year that are not including the donations that helped keep us in the black for last year. And just a quick mention of Medicare generally. I'm happy to answer other questions later on, but there were no big changes in terms of coverage for Medicare in 2024 when it comes to A and B. The premium for Part B remains $174.70. That is the new 2024 standard monthly premium. Based on your income from 2022, you may be subject to the income-related monthly adjustment amount. And as always, deciding to enroll in Part B remains a personal decision. It's March. March is Medicare March for us, so please keep a lookout on our podcast, our YouTube page. We will be doing updated versions of the FEHB and Medicare as well as the Medicare Advantage programs and more. And on, I don't have the date at the top of my head, I think it's March 28th, the last Thursday of the month, we will do a live Q&A at 11 a.m. to answer your questions about Medicare. So please plan to join us. Check that out at afspa.org/events. But we do that online once a month for the live Q&A. Finally, this is just a quick summation of the various programs and support opportunities we offer, both within our health program, but also through our ancillary programs and our financial wellness program. So I encourage you to take advantage of all of these and join us. We want to be partners in your health, and we take great pride in caring for your health worldwide. So I'll pause there. I think we're going into a break, and I thank you for your attention. For those of you who are here in person, please take advantage of our partners' expertise, and we'll see everybody back in about 10 minutes.
It is with great excitement, everyone, that I introduce you to our next speaker of the program, Dr. Blake Bueltel. Dr. Bueltel currently serves as a senior client executive at Teladoc. He has over 15 years of experience working with large employers, health systems, and health plans on population health strategies. He has a clinical background in exercise physiology, and he also has professional expertise in health equity. He joins us all the way from North Dallas, Texas. Thank you for being here with us, where he resides with his wife and 3 sons. So everyone, without further ado, please join me in welcoming Dr. Bueltel.
Thank you. All right. It's a pleasure to be here, everyone. Thank you, AFSPA, Kyle, for inviting me to come out. And wow, I just have to say, after hearing about some of the benefits that you all have access to, you guys have a wealth of resources. And what I'm excited to do today is to talk about Teladoc's health and the role that we play, specifically kind of in your benefit ecosystem. So as you hear these program overviews, don't just hear me. I want you to envision yourself or your family members or people who are covered under your plan, utilizing these services and ultimately the benefit that they'll get from it. I'm going to start by setting a foundation with our mission, but I want to let you all know that I will be taking questions shortly after my presentation, and I'll be out there as well. Is that better? All right. So I want to let you all know who Teladoc Health is, and we have a mission to empower all people everywhere to live their healthiest lives by transforming the healthcare experience. So if you didn't know through previous conversations with Kyle, we are a virtual healthcare organization. So we like to do everything virtually. So to give you an overview of our programs, I want to start with one of the newest ones that is available through the Aetna partnership with AFSPA. It's our primary 360 whole person solution. As Chairman Tracy stated, the importance of primary care can't be understated. And we have a virtual solution that we can provide to AFSPA members. It gives you access to a provider who serves as kind of your quarterback of care, who also gets you access to some of the other programs that I'm going to mention as well. So it becomes essentially your virtual front door to the healthcare system in Teladoc Health as well. So in these typically 40-minute interactions with your provider, which you may not get that in person, you can get that with us. They go over an overview. We talk about preventative screenings. They get an understanding of your history, and then if necessary, we'll make referrals both within the Teladoc Health ecosystem or maybe even outside of that, just based on where you're at in your healthcare journey and how we can best provide you with services. And so I can't understate how important primary care access is, and the fact that you get 40 minutes with a provider to actually truly understand you is something that is really important, and something that we often find is one of the greatest benefits of that particular program. As you'll see on your screen, there are several kind of ancillary programs that are also being provided through to AFSPA members through Teladoc Health. And so what I'll do is I'll just dive into one right now. So chronic condition management is a program that we provide. AFSPA provides nearly all of the services that we have. And so through our programs, if you're dealing with the condition of diabetes, hypertension, weight management, or diabetes prevention based on conversations that you've had with your provider, you can access our services. The best thing about it is what you'll see on the screen here or on your screen at home is the connected devices that we actually get to put in the hands of our members who are dealing with these chronic conditions. You know, if you have diabetes, you get a blood glucose monitor, hypertension is a blood pressure cuff, and we also provide scales as well. The great thing about these things is they're very intuitive. They're powered by machine learning and AI. So they're constantly responding to the results that we're seeing, which means it helps to keep your provider, if not in our network, your provider that you see in the loop by being able to provide them with, up-to-date results based on the chronic condition that you're dealing with. And once you step on the scale, simply it gets sent to the cloud. It becomes a part of your medical history. And then again, based off of those results, we're sending you in time nudges, either through the device, through your application that you have on your phone, or if you do it through a desktop monitor as well. You can create care plans, you can set goals, you can do 5-day challenges that help to build a plan and program to build a solidified habit that's ultimately going to allow you to make the changes necessary to reap the benefits of this particular program. And I'm going to give you both a higher level overview of each of these, but again, if you have questions, we can save them till the end, or I'll be outside as well. One thing I do want to mention is that chronic condition management, or CCM, is available both domestically and internationally. The program I just mentioned, Primary 360, is something that's only available currently to in the U.S. I think that we've all seen with the onset of the pandemic and in the results that we've seen is that mental health has been, my apologies, I'll just hold it. Mental health has been something that has been a recurring theme in not only the coordination of care, but also just with everyone, myself included. So we provide a mental health service. We also provide a digital mental health solution that you can access through your phone. Mental health in our case is provided through our partnership with Aetna and is also available domestically and globally. It gives you access to somebody who's going to help you with your mental health. It can be a dedicated provider. You have the freedom and ability to pick who you choose to have as your care provider by going through what we call a negotiated scheduling process. And so you essentially get to choose from, based off of what you state in your intake that you would like to work on, we will present you with options, but ultimately it's your choice to decide who you want to work with, to help to address, something as serious as mental health care. And so as you meet with your provider, it can be through visit on a video or through your phone, and you basically get a tailored experience with your provider based off of your needs. Again, as Kyle mentioned before, meeting you where you are, helping to understand not only what you're going through clinically, but what you're going through kind of in your broader kind of ecosystem, taking into account social determinants, taking into account all things that are important when assessing somebody and determining the appropriate care plan for them to make improvements. The next one is our general medical. This is also through in partnership with Aetna. This is something that's also available domestically and internationally. This one is kind of what Teladoc Health is known for most. This is our virtual urgent care solution. So this is something that's often used when you can't access a primary care provider in a timely fashion, or maybe you're feeling so ill or somebody in your family is feeling so ill that you can't actually make it to a physical location to see a provider. So what you can have access to our providers is to help to meet you in the moment with issues like, flu, cold symptoms. We do have the ability to provide prescriptions. There are some nuances internationally that I can go through at another time and in the follow-up. But we do have the ability to support your needs in the moment. You can meet with somebody right then. You can do it on the phone or video, or you can schedule a follow-up at a time that's most convenient for you. This one is personally for me. I think it was mentioned that I have 3 children. And so rounding all of them up to get into a car to go see their pediatrician sometimes just isn't feasible. So I am an ardent user of the Teladoc Health Services, and General Medical is one of my favorite because of the convenience that it provides me, and because I've had such great experience with it. Simply, getting a prescription called in that I can go and pick up, and it's just been immensely helpful for me personally, and can be to you as well in the moments where you need it. I want to dive into dermatology next. This is something, again, this through our Aetna partnership. This is for the U.S. Participants only. Dermatology is also something that I found very useful for myself personally. So we have a broad network of board certified dermatologists that service this program. The nuance here that's different from our other programs is that the interaction is actually asynchronous, which means it's not going to be in the moment. It's good for this particular care because you actually have to go through an evaluation that if you've been to a dermatologist, oftentimes it's actually physical. They need to see the spots that you need reviewed. And so how we accomplish that virtually is that you get the opportunity to submit 3 pictures of the area that you want to have looked at. And then the dermatologist will review those pictures and will provide you with their recommendation. Sometimes it may be a follow-up to ask for additional information or pictures, so they make sure that they're making the right and appropriate care recommendation after you utilize the service for dermatology. And lastly, I want to dive into nutrition. So we do have a nutrition program. Nutrition, for me, I think it was stated that I have a background in exercise physiology. Nutrition is the basis of health. And so the ability to manage and improve what you intake is ultimately going to be a precursor to determine how well you manage your health over the long term. And so AFSPA is providing a service called nutrition, where you get signed up and you get to meet with a registered dietitian to understand your needs, understand what your goals are, and put together a plan, whether that be through helping you understand what you need to buy within the grocery store, answering questions about reading nutrition labels, because sometimes there are words on there that have more syllables than I care to even attempt to read. And it really provides you, again, with a one-to-one person that gets to work with you and provides you care tailored specifically to what you need in the moment. I will say, because this program is only provided domestically, if you are somebody who's dealing with weight management, for example, that program also has expert coaches who are often registered dietitians as well. So they can still work with you over time to do the exact same things that a nutrition standalone program can do. They can do it in the context of weight management. So I do want to end with hoping that you did what I asked at the beginning, was not just to hear the bullet points, not just to hear the facts associated with the program, but to envision how you can take the next step to utilize one of these programs to better your health or better somebody in your family's health. AFSPA is providing excellent services. I'm grateful that Teladoc Health is in their ecosystem so that we can provide these services to you. So at this time, I'll open it up to any questions here, either through Q&A or in the room if there are any. Yes, ma'am.
If you have an existing GP, general practitioner, are you able to use Teladoc to speak with that practitioner and get services?
So the question was, if you have a general practitioner, can you utilize Teladoc Health to communicate with that provider to provide you with care? So all of the programs that we provide that you have access to have the ability to communicate with that provider. We put the power in the hands of the members and individuals who utilize our program. So if you are in a condition management program dealing with a condition of diabetes, as an example, you can be able to print a longitudinal record and send it to them directly via email or fax, in which we call a health summary report. And so that's the type of information that your provider will need to understand, what is happening outside the walls of their clinic. And that's how we, as a partner to AFSPA, provide that service. So to a long-winded answer of saying, yes, we have the ability to communicate, with your provider.
If you have Medicare, would that be would Medicare pay part of this, or would you'd have a copay from AFSPA? Your question.
It's a great question. And if you didn't hear it, it was, does Medicare cover this? And in fact, this is not a Medicare benefit. This is an FSBP benefit. It would be billed directly to the plan. So, and these services offered from Teladoc are available at no cost to FSBP members. So that's both the primary 360, the chronic care management programs, as well as the general medicine, mental health, nutrition, and dermatology. So all of those are available, no cost to members. They come directly to us.
Hello, everyone. I'm Maddie, working on the virtual side of things. So we have some live questions that we will be asking to Teladoc. Someone has asked, how do I access telehealth services while living abroad?
It's a great question. And I would love to provide whoever's going to send out the meeting notes and minutes the exact link that you need. But it's just a website or through the app.
All right, and we have another question that says, can telehealth doctors prescribe medication for overseas workers?
Yes, so that's where the nuances come in, because depending upon which country or location that you're in, I think even internationally, sometimes it's not even referred to as a prescription, it's a recommendation. But depending on where you're at, we still have the ability to prescribe.
All right, and do Teladoc's mental health offerings include acute crisis therapy?
It's a good question again. It depends on if we're talking domestically or internationally. Mental health services are meant to be longitudinal. They're meant to be not necessarily emergent or urgent issues. We would likely divert you to somebody who can provide you acute care in that crisis. But as you become more stabilized and it's become more moderate, that would be a time where you would engage in having a supportive longitudinal relationship with a mental health provider.
Perfect. I believe that's all of our questions live.
That's it. Yes, sir.
In responding to the question from the woman about hypothetically being in Alaska somewhere, you said it's good to register beforehand ahead of time and take care of those things. So where do I register? How do I do that?
That's a great question. Since you're in person, I can help you with that. But I will provide links that can be provided after to everyone so that you don't have to come through the internet to figure it out. All right. Thank you so much for being attentive. I'll be out there for the next hour or so if you have any additional questions. Thank you for having me.
Are we up? Yep, working again. Thank you so much, Dr. Bueltel, for that helpful and informative presentation. And as he mentioned, he'll stick around to answer any other questions that you all may have about the offering. So now we're preparing to transition to a recording from one of our other partners, our newest partners from Maven. They were unable to join us live today, but they pulled together a brief presentation which will play in the media player box for those of you who are joining online. Although our partners from Maven aren't on site with us today, they are still welcoming questions from everyone. You can reach out to them directly at support@mavenclinic.com. We'll be sure to share that with you all electronically as well. Or you can submit your questions in the Ask Question box online, and one of our team members will be sure to get those questions over to Maven. And then in addition, there will be slips here as well for individuals who are joining us in person, where you can write down your questions. We'll also make sure that those get over to Maven in a timely fashion. So with that, let's tune in and hear what our partners over at Maven have to say.
Hi, everyone. I'm really excited to be here to tell you about Maven, which is a new benefit that's available to FSBP members. Today, we'll go through what Maven is, who's eligible, and how to sign up. If you have any questions, we'll be sure to provide you with contact information to how to get those questions answered after the session. First, wanted to just give a quick introduction. My name's Teresa Wilkinson. I work here at Maven as a Director of Client Success. I currently live in Massachusetts with my husband and 2 young daughters. So I'm not only here as a Maven employee, but also as a Maven user myself. I've personally found Maven to be incredibly useful, and I'm really excited to share more with you today. Before I go into everything Maven has to offer, I want to sort of take a step back and talk about where Maven started and why we're here. So I think for a lot of people, and this is really myself included, before we are really in the family planning stage, the expectation is often that it will be very linear. You get pregnant as soon as you're ready, have a healthy pregnancy and baby, and then return to work as if nothing really has changed. And the traditional support model for expecting parents really reflects this. However, as I have come to understand the process from my own personal lens and also have seen lots of friends and family go through it, the journey to parenthood is typically a lot more complicated and requires much more personalized support. Many people need to consider male or female fertility treatments or have conditions they need to manage in pregnancy, like high blood pressure. I think even for people who have something close to that linear experience, they still deal with sleep regressions and growth spurts or food allergies. So even the most straightforward paths to parenthood have their challenges. And then you take all of that and return back to work with this very new part of your life, really finding ways to assimilate back into the routine you had before. It's not easy. Going beyond the reproductive health journey that you see here on the screen, we also know there are very similar challenges with menopause. Menopause is often poorly understood until you're sort of going through it yourself, and there isn't a great standard of care for menopause treatment. So that's really where Maven started. We've created a program that takes highly skilled providers and allows them to meet members exactly where they are and need support on their family forming and reproductive health journey. This program is not just for women. It's not just support for pregnancy. Maven was founded to really address all the complexities of family building across all different paths to parenthood, and now also support parents raising their children and also women going through menopause. And the way that we do that is through our virtual clinic. So Maven Clinic is our full name. That's exactly what we are. We're a virtual clinic that provides end-to-end support for reproductive and family health. And there are really 3 primary pillars of our service. The first is our dedicated care advocates. These are our members' go-to. So the first person you'll get paired with when you join Maven, and then the care advocate will stay with you throughout your program. So they'll get to know what moment you're in, what areas you might need extra support, and they'll also recommend relevant providers, help book appointments, and make referrals as needed. The second pillar is on-demand access. So Maven's an app, and through Maven, our members have access to a really expansive network of women and family health providers via video, chat, message, or phone. So really any time of day, and I actually do mean 24/7, 365, users can get a hold of someone through Maven. And then the third piece here is a supportive community and content. So we have content that's regularly published on our app about tons of different topics. It's all vetted expert advice. So it's a lot more reliable than the late night Googling that we might all do. We also have different community forums on a variety of topics, so users can really connect with other people that are going through a similar experience. And we'll talk through all of these in more detail next. Going back to the care advocates. So our care advocates, they're amazing, and they provide concierge support to all Maven members 24/7. So this would really be your first touch point when joining Maven. It's like a 10 to 20 minute conversation, and a care advocate's job is really to get to know you, to understand why you signed up for the program, and identify the best resources for you. My first conversation with Emily, who's my care advocate, was really relaxed. She asked some questions about what I'm looking for support with. And after we hung up, she provided me with a list of Maven providers relevant to my current situation with young kids. She sent me some resources and classes that she recommended within Maven. And then we also talked about how she can put together a list of in-person and in-network providers for me if I ever decide I need it. That last piece is really important because in addition to being experts about the Maven app, our care advocates are also experts in the other medical health and wellness benefits offered to FSBP members. It's also our goal to make sure that we're providing culturally competent care, and that's across our care advocates and providers. Our care advocates speak over 15 different languages, and they come from a variety of different backgrounds. So users can really design a care team to be exactly what you need, whether you have a certain gender preference or a language preference, etc. I've mentioned that our care advocates and providers are available 24/7 a couple of times, but just to really underscore that, I truly mean 24 hours a day. This is one of the things that I think is the most valuable about the Maven program. When I joined Maven, I had a question about the right way to change around feedings for my baby, and I texted a lactation consultant at 8 p.m., got a really quick reply with the information I needed to make a decision for that overnight. Which is just one example of a provider I personally have met with, but Maven has over 30 different types of providers that are available to FSBP members and can provide you with really holistic care, both mentally and physically, as you're navigating through the family building, pregnancy, parenting, or menopause journeys. So other examples of providers members have access to through Maven are things like a career coach, sleep consultants, pelvic floor physical therapists, high-risk OBGYNs. These are all available free and on demand every day of the week, any time of day. And this is just to call out in addition to a PCP, an OBGYN, a pediatrician. So you'll of course still have these in-person appointments, but Maven is really meant to be wraparound care to support in the more in-between moments with specific needs that might come up. I mentioned this about our care advocates as well, but it's our goal across the Maven experience to provide culturally competent care. So having providers with a diverse set of backgrounds is really important. You can see here our providers speak over 35 languages, 40% identify as Black, Asian, Middle Eastern, or other, and our care advocates can help filter based on the criteria that's most important to you when you're seeking care. Moving on to that sort of third pillar we talked about, the content and community that Maven provides. The biggest thing here is that these are really resources our users can trust. I mentioned this, I'm an expert late night Googler, or I was before I had access to Maven. I did it through my entire pregnancy. Anytime my girls were going through something, a lot of, is spitting up normal, which spoiler alert, it is, and how to handle tantrums. And there's just so much information on the internet. And some of it is great and super helpful. And some of it's actually really bad and not helpful, but none of it is regulated. So the great thing about the content on Maven is that it has all been vetted by providers, which to me makes it feel really trustworthy. Outside of the content, we have a variety of virtual classes led by Maven providers that happen both live and on demand. So you can see some examples of the topics we have covered here. We have childbirth education, adoption 101, what to expect during menopause. The list really goes on, and these classes are available for free at any time. Following the class, if you want more information, you can book an appointment with a pediatrician or a doula to talk in more detail about your specific situation. And then, of course, there's our community. So the community at a really high level is like a message board that allows members to interact with each other, and it's moderated by our Maven providers. So we're making sure that the responses that are coming in continue to be information that's trustworthy. This is a really amazing place to get support from people in the same stage as you. I keep an eye on the community for working parents, and I've seen posts supporting parents who are feeling overwhelmed about going back to work, and then also concerns about sleeping that a provider might jump in and address. So there's a ton of content, and as with everything, our care advocates can help make recommendations for which of these resources might be the most useful for you. And so now, knowing a little bit more about Maven, I wanted to make sure we go over who is eligible for the program and how you could access. So this screen here shows what FSBP members have access to, and an important call out is that this also includes partners, spouses, and dependents of FSBP members. So you can see on the left, members have access to our fertility and family building program. Everything that falls under this category is covered today. You can join right now. Members can sign up for this track if you are thinking about starting a family, either through pregnancy, adoption, or surrogacy, or if you are currently trying to get pregnant, regardless of whether it's in the early stages of that process or if you are already going through fertility treatments. Maternity and newborn care is a track available from the day an FSBP member is pregnant through the baby's first birthday. And members can join this track during any part of that time period. So you can join if you're currently in the second trimester or if you have a 4-month-old at home. This is a very busy time of life, but the program will support you through pregnancy, which we talked a little bit about. Postpartum, we have mental health providers, pelvic floor physical therapists. We will support members through miscarriage and loss, which is sadly a reality for many families. And then the newborn stage, when there are lots of feeding questions or milestone questions. And then career coaches are available as members start to think about transition back to work. For parenting and pediatrics, we are supporting parents who have children over the age of 1. Maven provides access to providers like pediatricians, parent coaches, occupational therapists, which are all available 24/7. I think in this track, the content also really starts to shine. We have content available on things like potty training or picky eating, tantrums, the things that are sort of age appropriate, but still really hard and always evolving. And then, as I mentioned, one of our most recent offerings is menopause and ongoing care. So again, this is to really make sure that we're supporting the entire reproductive journey. We offer support for perimenopause, menopause, postmenopause. Those early menopause symptoms can be confusing and it's difficult to know how to manage. So having early intervention can be incredibly important. We'll also continue to offer mental health support and career coaching during this time, which can be incredibly helpful. You can sign up for the menopause program before you have a diagnosis of menopause. So this is if you're thinking that this might be something that's going on, you can sign up for the menopause program today. I also thought it might be helpful before we move into how to sign up to show you a couple of member journeys to hopefully bring Maven to life a little bit more. So this first member journey is Julia. She's a single female. She's based in Germany and is navigating the adoption process and using Maven as a resource. As a first step, Julia's care advocate is going to connect her to an adoption coach who has experience in cross-border adoption. One of the most complex parts of this journey is all the legal guidance required. So Maven's global operations team is also going to help Julia find a list of vetted lawyers in Germany, where she's based, that specialize in intercountry adoption. The journey is long and can be very challenging, so Julia continues to meet with a Maven mental health specialist regularly, as well as also engaging with Maven's educational content around the adoption process and also what she needs to prepare to become a first-time mom. The second journey here is Mina and Adam, who have been trying to conceive for about a year, and they're interested in learning more about fertility treatments. As we discussed, their first step is really to meet with a care advocate who understands what Mina and Adam are looking to get out of their experience with Maven. And the first provider they meet with is a fertility specialist who reviews Mina's diagnostics and then helps them understand the IVF process and really how to get started. While they are undergoing IVF, they continue to leverage Maven's content and community for support on that process and continue to learn about what to expect as they go through. And then Mina and Adam have a very happy ending. They learn they're pregnant after IVF, and so they transition into Maven's maternity program. Their care advocate stays the same, so with a good understanding of their experience and who they are, what they might be looking for, the care advocate can continue to provide guidance on how to receive care through Maven during Mina's pregnancy, her birth, and then beyond. And then lastly, we have Jane. She is 49 years old and generally really healthy, but starting to suspect that she might be in the early stages of menopause. So Jane enrolls in Maven's menopause program, and after answering her onboarding assessment, she's paired with her, you guessed it, care advocate. Jane's care advocate recommends a couple of relevant providers, starting with a physical therapist to address some of her joint pain. It's also recommended that she meets with a Maven OB who does confirm that Jane is showing signs of menopause and reviews treatment options with her. Jane's care advocate also helps to put together a list of in-person and in-network OBs who specialize in menopause because Jane's interested in an HRT prescription. And then as she's getting treatment, Jane continues to read articles on Maven about different options, what to expect as she's going through menopause, and then also joins drop-in groups to connect with others who are going through menopause themselves. Okay, so hopefully you have a good sense of how you might use and benefit from Maven. So I also want to spend some time on how to sign up. So you can either download the Maven app directly from the App Store, or you can go to the link you see here, mavenclinic.com/join/FSBP, and you'll be prompted to create an account with some demographic information. Before we go through that, probably the most important thing to remember about this process is that if you have any questions about accessing Maven, you can always reach out to support@mavenclinic.com, and we will work directly with you to get you enrolled. A couple of quick call outs as you are creating your profile. As you're entering your profile information, this is going to be compared against information that we get from your health plan. So I'd make sure that you're using a legal first name and legal last name, not a nickname. You'll also want to make sure you use a personal email address, and that'll be the primary email we use to communicate with you. We just want to make sure you have access to Maven at times where you are on leave or not working. And then you create a password like you normally would. We'll also ask for date of birth and phone number, and all of that is just to make sure that we're able to verify your eligibility for the program. If it is your spouse, partner, or dependent that's enrolling, they will be required, they'll create their own Maven account, and they'll be required to enter in a few more pieces of information, likely about you, the member, as a part of this sign up and verification process. But again, if you have any issues enrolling, you can reach out to support@mavenclinic.com and we'll work directly with you. After the initial sign up page, you'll choose a track that best suits your needs. That would be maternity, fertility, parenting and pediatrics, or menopause. And then we'll ask you some questions just to understand a little bit more about what you're looking for to really begin building your care team and content that's available to you. Okay, so to recap, Maven is free virtual care available 24/7, 365. FSBP members can sign up at mavenclinic.com/join/FSBP on your desktop, or you can download the app. The app is my preferred experience, but both will work. And if at any point you run into issues, you can always email support@mavenclinic.com. And the only other thing I'll underscore again is that once you are enrolled, we really love to encourage you to utilize your care advocate. They're there to help. They're super responsive, and they will really make sure that you can get the most out of the Maven program. Okay, that's all I have. I really appreciate your time today. And if you have any questions about Maven or how to sign up, please email support@mavenclinic.com. Thanks, everyone.
And thank you, Teresa. We appreciate that wonderful presentation. She said it throughout her presentation several times, the best way to reach her. So for those who are joining online, feel free to reach out, support@mavenclinic.com. Everyone in the room, you're welcome to also submit questions there if you'd like to reach out to Teresa and our colleagues over at Maven. If you'd prefer, if it's easier for you to submit your questions today, our Director of Outreach and Communications, she has some slips that you can actually fill out questions, and we'll make sure to get that information over to Maven as well. So feel free to take advantage of that. I do want to mention here before we break go into our second break, that you can also check out our latest episode of AFSPA Live. We talked a little bit about our AFSPA Live program, in which our CEO, Kyle, actually sat down with our colleagues at Maven just to talk through all of the wonderful program, the offerings that this program has to offer. A recording of the episode can be found on YouTube at AFSPA Cares if you're wanting some additional information there. But we're really thrilled here at AFSPA to be able to offer this to our members and to provide these additional supportive services to members at various stages of their lives. And with that, we're going to transition into our next break, another 10-minute break. So feel free to get up, stretch, network, take advantage of the snacks that we have in the break room, and we will see you in just a bit.
Welcome back from break. There were apparently some questions and comments online, and a few here in the room. Well, where's Paula? I am obviously not her, but you all may have missed this. She announced her retirement in the fall newsletter last year after, actually just after her 35th anniversary with AFSPA. She started AFSPA in 1988 and had served as the CEO and Executive Vice President since 2009, I believe it was. So I'm very fortunate to continue to learn from her and be able to rely on her advice as an advisor. But she is not working full-time for AFSPA any longer. And I fully acknowledge I stand on her shoulders, and I appreciate the support I've received from our board and staff and our members. So I'm going to pause there. I think we've had a number of questions, and as we gather some of those questions together, I just want to address one that came to me during the break, and that was sort of pros and cons of PDP versus sticking with the prescription benefits under the FSBP high option. And so why would someone want the PDP? Well, the reason we offer the prescription drug plan was because it does offer savings. It offers savings to the plan overall, which means lower premium increases for everybody going forward. We've also structured it to offer lower costs to members and a wider pharmacy network and a greater variety of options to obtain your chronic medications, specialty medications, and even those acute pills like an antibiotic or something like that. FSBP is paying the baseline premium into the PDP plan with Express Scripts on behalf of members. Now, why would somebody not want to go with this option? Well, the number one reason that we hear from members is the same reason people don't opt into Medicare Part B, and that's because their income would make them subject to the income-related monthly adjustment amount, or IRMA. So they would actually have to pay, they would be assessed a cost each month by Social Security. And this cost, though it's less than you see for Part B, it starts at $12.90 and goes up to just over $80 per person per month. That can add up quickly for people. And if you're not taking a lot of medications, if you're not taking specialty medications or other high-cost medications, maybe you just have a generic or two, then weighing the costs of that and the savings you would see under PDP against the cost that you would see with IRMA, you've got to do the individual cost-benefit analysis there. So that gets to the heart of what I was discussing with one of our members during the break. But I think we've had some questions, Maddie, if you want to start with some that we've received online, and then I'm happy to come here to the room.
Absolutely. So if you've heard us furiously typing over here in the live audience, we are trying to answer as many questions as we can online. So we will start with some that we had submitted when you guys registered. Someone has asked, will AFSPA consider FSBP premium support for enrollees of standard Medicare in addition to the AFSPA Medicare Advantage plan? It would make sense as Medicare enrollees save the FSBP a great deal of money in benefit payouts.
Okay, that's a great question. So I want to start off with an explanation for those of you who are not familiar with the Medicare Advantage plan that we offer. I'm going to use the full name once again, just one time. This is the Foreign Service Benefit Plan at the Medicare Advantage plan. This includes a Part D plan as part of that, different than the PDP we were talking about earlier. But with the Medicare Advantage plan, and it's been surprisingly popular over the last 14 months that we've offered it. More than 500 people have enrolled and remained enrolled. This is different from commercial Medicare Advantage plans. It is within the federal program, and you remain enrolled in Foreign Service Benefit Plan. You give a call and you opt into the MAPD, what we call it, Medicare Advantage Plan with Part D. If you have opted into the MAPD, you receive a Part B, because you must be enrolled in Medicare A and Medicare B. You receive a Part B premium reduction of $75 per month for every month that you're enrolled in the MAPD. And this premium reduction is only available to members who are enrolled in the MAPD. It is not available, we are not offering it to members who are enrolled in, say, original Medicare, Part A and Part B, and FSBP. Now, the question, just to get back to it, was, are we considering offering it to people who are in original Medicare, A and B, and FSBP? And at this time, we are not, because we recognize that our members are part of a global population, and so we would be offering to a wider variety of people an incentive of sorts that wouldn't necessarily be available to everyone. Additionally, we also recognize that, and I hear the point the questioner is making, oh, this might be more people will sign up for Part B and reduce the cost. We've also done a cost-benefit analysis on different age groups within the plan, and a retiree who has Medicare A only and FSBP, their claims average about 3 times as much as someone who is not Medicare eligible. So someone in their 40s, let's say, their claims are about 1/3 of someone who is Medicare age 65 and older, who just has Medicare A and FSBP. You add in Part B to that, and the amount that FSBP pays comes closer to the same as a younger member of FSBP. So we would be saving money if we saw more people enrolling in Part B. It is a transfer of risk to Medicare Part B. But as of right now, we're not considering making an incentive or a premium reduction for people enrolled in original Medicare. We'll keep that on deck for future years, but we're not considering that right now.
All right, now we have a two-parter about Medicare Part B. They have asked, I just scroll back up to it. I have lost the question. When retired, how does Medicare A and B affect full coverage of FSBP? That's the first part.
Okay, so if someone has Medicare A and B, how does it affect their FSBP coverage?
Yes.
Essentially, if you're receiving care in the United States and you're enrolled in Medicare A and B, and you're receiving, you have FSBP and you're retired, you gotta check those boxes. Medicare becomes your primary payer. Keep in mind, Medicare A is basically hospital insurance. It pays for that inpatient hospitalization, a few other services, including skilled nursing care when you're in a skilled nursing facility. And Part B pays for our other medical services that we think of. And in that case, A and B, whichever is appropriate, pays primary. And then FSBP comes in and pays secondary. So essentially, you end up being 100% covered if you have Medicare A, B, and foreign service benefit. We waive our calendar year deductible. We also waive our cost sharing on those services that are covered by by Medicare and FSBP. So the other thing I will mention for services that are not covered by Medicare, but are covered by foreign service benefit plan, like massages, we will pay primary and we'll pay the benefits per the terms of the brochure. We also are the primary payer for services received outside the United States because Medicare does not cover you outside the United States.
So as a follow-up to that, say I have the Medicare Advantage plan and I am not getting the full $75 for my massage, what would you recommend I do?
Oh, so well, the Medicare Advantage plan is a different story. So the Medicare Advantage plan, again, great coverage. You have a lot of programs in there. Somebody asked about Silver Sneakers during the break. Silver Sneakers is available to members enrolled in the Medicare Advantage plan. But massages are one of the key benefits that are very different under Medicare Advantage. Medicare, generally speaking, doesn't provide coverage for massages. The Medicare Advantage plan that we're offering to be within Medicare rules does provide limited coverage for massages when they are medically necessary. You have to have a doctor's referral to be able to access those benefits. And you also have to go to a massage therapist who participates with Medicare and also will accept the network that the Medicare Advantage plan operates within Aetna. We have a partnership with a group called ASH, and there may be others out there who meet those criteria, but very few massage therapists participate with Medicare because Medicare doesn't cover massages. So if that is the case, this person, if the massage benefits are very important to that person, I would encourage them, they may want to consider opting out of the Medicare Advantage plan and coming back to the FSBP high option plan. You can make that change anytime, but that is one of the key benefit differences between the two plans.
All right, we're going to do a couple of Medicare questions because that is a lot what we have. Someone has asked, do you pay more in Social Security if you opt in for the PDP plan if you have a higher IRMA?
Yes, so there is their IRMA does apply to Part D, and it starts the first tier. If anyone filing singly makes more than, this is based on your 2022 modified gross.
Adjusted gross.
Your modified adjusted gross income. Thank you. 103,000 filing singly, 206 married and filing jointly. Anything above that, you will be assessed the D IRMA, and that's the Part D IRMA. So that information is actually linked on our website, afspa.org/PDP. You can look under the frequently asked questions. We have a link to the Medicare website where there's the full list of the income brackets as well as the IRMA amounts for those brackets. Question here in the room?
Yes, I understand that if something like a massage is not covered by Medicare Part B, that foreign service benefit plan kicks in. But what about if the foreign service benefit is better than what the Medicare pays for? I'm thinking of like cataract surgery, where the plan offers more nuanced lenses than is standard Medicare. So how does that work when the foreign service benefit is better than the fee fund?
Sure. In that case, and I appreciate the example of cataracts, because that's a specific one that's come about in recent years where Medicare Part B will pay their portion of the standard cataract surgery. But FSBP does provide the coverage for the enhanced lenses, the name of which is escaping me right now, but I think, I see nods in the room, people understand what I'm talking about. In that case, the claim does have to be submitted to Medicare first. And in this specific example, you need to submit because most providers will not bill any insurance for the enhanced lenses because very few insurance pay for it. We're one of the few. So in that case, specifically this, I'd encourage you to contact us even in advance of the surgery. We can put things in place to make sure it processes for Medicare, comes to us, and we can work with the provider or with the patient to get the bill for the other piece and make sure it's processed correctly. Yep.
Yeah, thank you. So my question is a little bit more of a comment. Very happy with the Foreign Service Benefit Plan overall, but my my question is about, member medical privacy versus third-party vendor marketing. And, just a few things I noticed, like I recently got some physical therapy for my neck and back. And then I start getting, flyers in the mail from Hinge Health and emails. I went to my doctor for some blood sugar tests, and then I start getting flyers from Livongo. So I'm just a little bit concerned about that, like to what extent our medical information is being supplied to for-profit third-party vendors. So I think you should look at that issue and maybe there should be an option. I understand like to exist, you have to have vendors that can make profits. I get it. But, people are very sensitive about their medical information going out, especially in the digital age where everything's getting compromised on the internet. So just think you should look at that issue.
I appreciate that. And I will just reassure you, yes, we do work with multiple vendors. And Express Scripts being the main ones, but we have multiple other vendors we work with. And all of those relationships are covered by either business associate agreements, HIPAA, they're HIPAA protected, but I understand the concern. We can certainly continue to look at that and make sure that our members' privacy is protected.
Thank you.
Thanks. I have the Medicare A and B and the standard Foreign Service Benefit Plan. I have not participated in the Medicare Advantage. Now, my internist recently switched to concierge. So I pay an annual fee. She does not do anything with Medicare. Now, she does include, as part of the concierge fee, a lot of standard work. But how do I handle things that fall out of what's covered by the concierge fee?
And please remind me, because I know we talked about this, your providers now opt out with Medicare?
Yes.
Okay, that's a confirmation. Opt out with, so
I have to sign a contract every year with her.
Private contract, opt out. Yep. Neither the provider will bill Medicare, nor will you attempt to bill Medicare, and Medicare will not pay anything with that. So Tom mentioned this in his opening remarks. We're seeing more providers, both general practitioners and specialists in certain areas, move into this concierge area where they're charging hundreds or in some cases thousands of dollars per year basically to be a member of their practice. And that comes with something. A lot of times it may come with an enhanced annual physical or quarterly nutritionist visits. I've seen various things like that. Unfortunately, and I'm not sure I'm answering your question, so I want to double check and say, unfortunately, that fee is not something that we cover. We cannot cover the concierge fee. We've tried, we've gone with OPM and said, well, but look, it covers a physical. Can we process that part, pay for it? No. Because it comes through essentially as an administrative fee that we are forbidden from paying. When it comes to coverage with Medicare, and you're seeing, and generally speaking, even you're seeing an opt-out private contract provider, there's not a lot to be done. You can't bill Medicare; they won't bill Medicare. And the only thing that FSBP or any federal health plan can pay is what they would have paid if Medicare had been billed, and that's usually about 20% of the Medicare allowed amount. And the member then is on the hook for the rest. So on a per case-by-case basis, you may consider if you want to stick with this doctor and this works for you, does Part B still make sense for you? You do have the option of dropping Part B, but that may be the consideration. If that doctor relationship is important, you don't want to find a new one, you really like that. Does Part B make sense? Because if you didn't have Part B, FSBP would pay our benefits per the plan brochure. So if the doctor were in network, we'd be paying our 100% for preventive and 90% for outpatient after the calendar year deductible. But even if they're out of network, we'd be paying more than we pay now for an opt-out provider. We'd be paying 70% of the plan alone. So our hands are tied in that matter by Medicare regulations. That may be one consideration.
So that raises a question for me. Can you go in and out of Part B?
So you can't necessarily go in and out. You want to make sure you enroll in Part B when you're first eligible, or if you're still actively employed when you become eligible at age 65. You can wait until you retire, then you've got an 8-month special enrollment period. Once you're enrolled in Part B, dropping it, you really want to consider seriously, because if you drop it, let's say you enroll at age 65 when you're first eligible, you decide at age 67, you've got new doctors, they don't participate with Medicare, they're opting out of Medicare, you decide to drop Part B. But then at age 70, you're thinking about coming back. Well, at that point, you've been out of Medicare Part B for 3 years, and you would be subject to a penalty of 30% of the premium every month, as long as you remain enrolled in Part B. So it's every 12-month period that you could have been enrolled in Part B and weren't, it's a 10% penalty, and it just adds up. So you can come out of it. Getting back in would be where you would face the penalty.
Is it 10% or 30%?
So my example was 3 years, so it would have been 30%, but it's 10 years for every 12 months, 10% for every 12-month period. Yeah. So that's why I would encourage you, if you're in this situation, don't go about it lightly, leaving Part B, but you don't have Part B, you've still got the protection of Foreign Service Benefit Plan. I assume you do if you're here.
So I had 2 questions. One was on the concierge service, which you pretty much explained. I want to make sure I understand this. So you said if you're in Part A and if you Medicare Part A and B, foreign service would just be like 20% of the concierge service.
So let me clarify that. That's a good question.
I understand that, yeah.
What I'm saying is, if you're going to a private contract opt-out provider, that's a specific category within what Medicare considers providers.
Right.
Doesn't have to be concierge, could be another provider.
Right.
If it's private contractor opt-out, then FSBP can only pay what we would have paid if Medicare, if you got A and B, you can only pay what we would have paid if Medicare had been billed, which is 20%, typically 20% of the Medicare allowed amount.
And if you opt out of Part B, they would pay like 80%.
For outpatient services, we would pay our benefits per the terms of the brochure based on the provider's network status.
Yeah, I'm not even thinking about opting out. Yeah. But anyway, my next question has to do with overseas travel. So if you're overseas and then you have to go see a doctor, I mean, more than likely, because I know some places like in Germany, because I was in Germany, they take AFSPA, but some other places don't. How long do you have to file your claim once you get back overseas?
It's a great question. So if you're overseas and traveling, you see a local provider, how long do you have to file your claim? Because in most
Medicare
instances,
doesn't pay overseas, right?
Yeah, in most instances, you're going to pay out of pocket,
Right.
You come back. It's the same as stateside claims. You have until December 31st of the year after the date of service. So if you were overseas today and saw a doctor, you'd have until December 31st of 2025 to file that claim. And that's the timely filing deadline for all claims. So that there are some provider agreements stateside that manage that, where the provider may be required by their network agreement to submit it. But for overseas, you've got until December 31st of the year after you receive the services.
And if you went to a place overseas that does accept AFSPA, then you would just, y'all would bill us whatever.
Yeah, so the question was if you go to a direct billing provider,
Right.
where we have the partnerships overseas, yes, if the services you receive are covered by a direct billing arrangement with that provider, they would bill us directly and they would collect your portion from you at the time of service.
Right.
Yeah, that's the idea. We've got more than 200 providers around the world that have come into these agreements with us. They are focused in certain geographic areas: Germany, Korea, the UK, places where we have a lot of members, or like with the UK, where we see a lot of medevacs. from across Europe and North Africa. We do see that, but we are expanding them into other countries. We actually, with help from the embassy and others, we were able to come to an agreement with a provider in Moscow last year because it was very difficult, given sanctions and other pieces, for people to pay for outpatient care with wheelbarrows full of rubles. So we were able to come to an agreement for that service.
Is there a list? Is there a list of providers?
There is a list.
overseas?
Oh, I'm so glad you asked. The question is there a list? There's actually a searchable list online. If you go to afspa.org/FSBP, on the drop-down menu, you'll see an option for overseas partners. You can read a little bit about how the agreements work there. And then at the bottom, you can sort by, you can filter it by continent, then by country, and then even by city. And on the city, certain places, sometimes they may have a suburb that they consider the city, but you're thinking of the larger metropolitan area. I'd say stick with the country for the most part, and then go from there and see what you can find when it comes to the participating providers. But it's all on there. And most of those places should have our sticker up that says FSBP accepted here when you walk in. And many of them also have international healthcare centers with English-speaking staff. They understand the benefits. They're happy to see our members because they know how to work with us, how to bill us, and that they're going to get paid.
All right. I'm sorry, we really have about 200 people online that have some online questions.
All right.
All right, so just wanted to confirm, if you have Medicare Advantage plan, can you use that overseas?
That's a great question. The Medicare Advantage plan does have some coverage outside the United States for urgent and emergent. So emergency care. This is not your overseas and you decide you want to have your annual physical at a provider overseas. This is your overseas and you fell and sprained your ankle and you're in the emergency room. That kind of coverage. So it is just for emergency and urgent care situations that the Medicare Advantage plan provides coverage. In that case, you would have to pay and submit a claim to the plan.
And we've gotten a cruise ship question. What do we need to know about retiree claims for care received outside of the U.S. or abroad? For example, a cruise ship outside the U.S. if you're not covered by Medicare?
I want to talk to my colleagues with other federal health plans to find out how many questions they get about cruise ships, because we get a lot. So if you have a claim from a cruise ship, in many cases, you may have to pay the provider, the cruise ship at the time, but you submit it to us. That it's typically, except in very rare instances, Medicare is not going to cover it. So you'll submit it to us, and even if you have travel insurance, typically they're going to want to see an explanation of benefits from your health insurance, what they'll pay before the travel insurance will kick in. So just send that to us, the itemized bill, include a note, let us know what happened, and that it was on a cruise ship. We'll take it from there.
All right, and if someone has Medicare Part D, so the PDP plan, are they able to get prescriptions overseas?
That's a really good question. So the PDP plan outside the United States, you could obtain prescriptions, again, in urgent or emergency situations. In that case, you would have to pay for the prescription at the time and then submit it through the PDP plan. You would also have to submit that. It has to have a US approved equivalent drug, and you will need to submit the NDC, and it'll come back to me what that stands for, number when you submit that claim. So it is not, again, meant for you to be able to go overseas, fill your chronic medications at a lower price, perhaps at a foreign pharmacy, and then come back. This is really just for emergency situations.
All right. Is FSBP considering offering a HSA for Medicare enrollees that are not Advantage?
No, we are not considering offering a health savings account or even a Medicare spend account, which I think is maybe what that person's talking about that matches with Medicare. We're not considering a high deductible health plan, which would be necessary to offer a health savings account. We are sticking with our high option for now and the options for the Medicare Advantage plan.
And can anyone in any of the Medicare plans use services like Teladoc, Maven?
It's a great question. So yeah, if you're enrolled in Original Medicare and FSBP, you can absolutely access Teladoc, you can access Maven. Those are FSBP benefits. If you're enrolled in the Medicare Advantage program, the MAPD, that does offer Teladoc benefits. Maven, to my knowledge, is not part of the offerings under the MAPD at this time.
All right. Can my college-age 23-year-old covered by FSBP buy a dental plan under AFSPA?
Absolutely. So, people do have coverage up to age 26. Dependent children up to age 26 have coverage under the health plan and some other plans. But AFSPA membership is open to children aged 19 and older in their own right to enroll in plans like our dental plan. So I encourage that person's adult child to go to afspa.org/dental to find out more about that. And I'm going to pause there. I know we probably still have a lot of questions. We will be happy to answer those. We'd be happy to see some of you online at a future AFSPA Live every last Thursday of every month at 11 a.m. Eastern. We're on Facebook. We're on YouTube. YouTube's the most reliable. We sometimes have some trouble with Facebook, but check us out. We accept questions in advance if you can't join us live, and then you can watch the recording and you can go back and watch all the recordings now. This recording, I think, will be available sometime in the future, but I think Twanisha is going to tell us about that. And that's it for me. So thank you all very much. Those of you in person, I'll be in the break room afterward.
Thank you so much, Kyle. Yes, just a quick a few reminders and closing remarks as we've reached the end of our program. Thanks so much for being here with us today. Just a quick reminder about the survey. Please take some time to fill that out, both in person and online. As I mentioned, we certainly value your feedback and appreciate the time that you take to fill that out. As Kyle mentioned, the on-demand recording of the meeting will be emailed to everyone who registered for today's program. Additionally, the recording will be available on the YouTube channel in the coming weeks with the closed captioning available as well on that version of it. Social media, you can follow us on social media, AFSPA Cares on Facebook, we're on Instagram, you mentioned YouTube, LinkedIn as well. The American Foreign Service Protective Association is how we're listed in LinkedIn, so please follow us there. Kyle also mentioned our AFSPA Live every last Thursday at 11 a.m. We also have our podcast. So we have many ways of interacting with you all having opportunities to interact with us to get answers to your burning questions. So please utilize those tools, take advantage of the tools that are at your disposal. I would be remiss if I didn't acknowledge and sincerely thank our outreach and communication team and our AFSPA staff today. That made all of this possible. Brian, thank you for your leadership and your hard work. Maddie, Maya, our Director of Outreach and Communication, Shanera, and leading the team. Can't forget about Michelle, who's joining us in Guam, from Guam as well. She's a very important part of our outreach team. And just thank you to all of our AFSPA colleagues who took the time out to support today's event as well. And last but certainly not least, thank you all. Thank you to our members for attending. Thank you for entrusting us with your care. We take it very seriously, and it's absolutely a pleasure to serve you all. So thanks for your time. Have a good afternoon and a very wonderful weekend, everyone. Thanks.